of the United Workers' Party, leader of the opposition and member of parliament for Miku South, the Honorable Alan Chasney. I also have his deputy, the deputy political leader of the United Workers' Party, former parliamentary representative for Castries Southeast, Guy Joseph, and I will be your moderator, Leonard Spider-Montut, the PRO of the United Workers' Party. Now, for today's discussion, we are going to focus mainly on healthcare in Saint Lucia. We are going to look at what passes for healthcare in this country, and we are going to look at the potential solutions, because we always provide solutions. But first of all, we will delve a little into what obtained prior to today and how we found ourselves where we are as far as healthcare is concerned. I need not remind you that the Saint Lucia Medical and Dental Association only during the course of last year indicated the dismal picture which our healthcare system is facing. We were told that it is the worst that it has ever been in our history. We were told that in terms of human resources, doctors and nurses were leaving in droves. We were told that there were not basic medication being provided for our people. And of course, on a daily basis, we hear our citizens complain on the talk shows how the conditions are, what exists and what obtains as medical care at especially our premier institution, namely OKEU and St. Jude's, where people find themselves sitting in hallways, on chairs, on the floor, unable to find beds, and where people go in with curable situations requiring treatment, but leave the hospital worse than they came in, and in some cases, perishing, dying as a result of the lack of proper health care that exists in St. Lucia today. But before I call on our first speaker to talk on the issue of healthcare, let me just indicate that when it comes to health in general, our economic health in this country is dismal. When you look at the infrastructural situation in this country, it is dismal. Everything in this country seems to be going through a downward spiral, and it is about time that we take stock to ensure that we reverse the situation. And you ask yourself, why have we found ourselves in this situation? That is because we have a callous, uncaring government that is not interested in the well-being and welfare of our people, but rather playing partisan politics, securing their own personal political interests, and of course, it's no wonder, no surprise, that their mantra is protecting the victory. Translated, that means keeping them in office to continue to enjoy power and the perks and trappings of being in office. If the government was in fact interested in the plight of the people of St. Lucia, there are a number of things that could have been done. There were a number of things that were not done that should have been done. There are a number of actions that they have taken that would not have been taken. And I just want to remind St. in their political myopia, the St. Lucia government has gone after officials of the United Workers' Party, in particular the political leader, the Honorable Alan Chasney, and denied St. Lucia of many initiatives that were started under the reign of the last UWP administration, and simply because it was initiated by Alan Chasney and his administration, they have decided to punish St. Lucians by either abandoning those projects or not continuing those projects. And I want to name for you a few of those projects that have been abandoned. And of course, let us be reminded that when that is done, it is not Guy Joseph, it is not Alan Chasney that is being affected. It is we, the people of St. Lucia, that are being penalized by a callous, uncaring government that is more interested in partisan politics as opposed to our well-being and our welfare. And so I want to mention, for example, in the constituency represented by Honorable Alan Chasney, there is a community center that is in Miku South, Blanchard, that is completed. But the government has been in office for close to 4 years now, and that community center remains closed. May I remind you that that community center is there for the service of the people of Blanchard and Micoud South. Not for Alan Chasney or the UWP, but the government has chosen to keep it closed. And I'm wondering whether they think that by so doing they can whitewash the legacy of Alan Chasney or penalize Alan Chasney in any way. You are the people being penalized, and it is about time that we take a stand and do something about it. Of course, the Soisel-Saltibus constituency is represented by the Honorable Bradley Felix, and in his time, in his effort to provide good representation for his people, he had 2 community centers constructed in his constituency. In PI, you had a community center constructed, and in Roblo, there was a community center constructed. To date, both of those centers remain closed. Now, that indicates, again, the callousness and vindictiveness of our current government. And of course, it is also an indication of the fact that they have no interest in social programs and amenities that will ease the sufferings of the people of this country. And we have Guy Joseph here with us as well, who was the former parliamentary representative for Castries East. And since he's here, I will mention to Southeast, sorry, Castries Southeast. And since he's here, I will mention to the fact that in Bexon, a community within his former constituency, okay, there is a community center. And I'm talking of community centers because as the former Minister of Social Transformation, I am aware, because community centers fell under my portfolio, I'm aware of the construction of those facilities and the representation provided by those individuals to ensure that those facilities were constructed. And of course, as in Micoud South, as in Soisel-Saltibus, the community center in Bexon remains untouched. It is closed because, not because there is not need for it, not because it can be made use of, but because it was built by a representative of the United Workers' Party. Again, they're going to penalize the people of those constituencies and deny them the use of those facilities that has been built for their purpose. And of course, since I'm talking about Guy Joseph, who is one of the deputies, let me just mention too, Senator Dominic Feder is the other deputy political leader in the United Workers' Party, and he will be contending to, of course, return as a representative for ancillary canneries. He too, had to see a similar situation in his constituency where, as Minister of Tourism, he attempted to bring tourism to ancillary canneries, and in so doing, an hotel was built near the waterfront in ancillary canneries, and a seafood restaurant was also established, and those facilities remain abandoned and closed till this day. Now, I want someone to say to me that those facilities could not have been made use of and that the people of ancillary could not have benefited from those facilities. Again, the callousness and vindictiveness of a government that is uncaring, that is more interested in politics rather than the welfare and well-being of its people. And, well, while I'm at it, I cannot speak of those projects. And, of course, the list is not exhaustive. I mean, I can go on and on in terms of projects that were abandoned by this government and, in so doing, affecting the lives of the people of Saint Lucia rather than improving it. And I was the former parliamentary representative for Grosile, and I worked with the government to ensure that some improvement could have been made to the Rodney Bay Highway so that we can ease the congestion that takes place there on a daily basis. But that project, again, was abandoned by the present administration, by the Philip J. Pierre government, and we still suffer on a daily basis traffic congestion on the Castries-Grosile Highway, whereas had that project been completed, it would have brought about a great reprieve, much ease to the commuting public of the north, people traveling from Castries to Grosile. Now let's get back to the subject at hand, what we're going to deal with today. But before I do so, I want to also mention that one of our primary source of revenue in this country, our ports, has been, I want to remind St. Lucians, has been given away to foreigners for the next 40 years. And they did so for only $40 million. Today, we get about $1 in terms of revenue on cruise ship passengers, whereas the foreigners to which the facility was sold get $10 as opposed to the $1 that we get. And so these are the kind of things that are happening. Another project that was well underway under the United Workers' Party administration, and we explained fully the need for the development of the HIA, the Huron-Ora International Airport, as far as the role it would play in terms of economic development in Saint Lucia, for the advancement of the tourist industry, and to provide and open up avenues for us in terms of development. That too was abandoned, because I imagine the people of the South do not deserve opportunities for employment. The people of Saint Lucia do not deserve having a state-of-the-art international airport that would enhance our economic prospects in Saint Lucia. But now let's get back to the issue at hand, which is healthcare. You would recall too that the United Workers' Party inherited the Victoria Hospital with all its woes, and after a bogus ceremony, a naming ceremony for the OKEU Hospital, because of pressure from the European Union, who had provided us with the funding for the building of that hospital, they were anxious to see that the hospital was open. So they pulled a bluff on the Europeans, had a naming ceremony. As soon as the Europeans took their flight and went back to Europe, the hospital was reclosed and remained closed until the United Workers' Party came into office and had it opened. In Vieux-Fort, we know of the fire that took place in 2009 and the efforts that were made to rebuild the St. Jude Hospital. Since then, some 14 to 15 years later, St. Lucians have to, the people of the South, but in particular, have to grapple with being at a makeshift hospital at the George Odlum Stadium. Now that you will hear a little more, our speakers will elaborate on for you. But I just have to mention the fact that the United Workers' Party, in its wisdom, recognizing that the burnt-out St. Jude's structure was a structure built in the 1940s, and it was not suitable for the purpose of serving as a hospital, and that the people of the South and the people of St. Lucia deserved an international state-of-the-art hospital, and so in his wisdom decided to build a completely brand new hospital in the South, and that too was abandoned by the St. Lucia Labour Party, and they have reverted to the old building that was constructed in the 1940s and are now trying to convert it into a hospital. And after they had already spent, during the previous term, $130 million on the construction of that same old hospital, they are spending an additional, to date, an additional over $200 million. And we still do not know exactly what the ultimate cost will be. We do not know when the opening will take place. Almost 4 years into the administration, that hospital is still not completed. Ladies and gentlemen, we are in dire straits as far as health is concerned in this country. Something must be done. The health of the country is a very important aspect of life in the country. Our life depends on our healthcare system, the services that are provided in healthcare. Our productivity depends on it. Our economy depends on it. Our quality of life depends on it. And so this is a very important topic that we must delve into and deal with. And so to go into further detail and to elaborate a little further as far as the dire situation that we face as far as healthcare is concerned, I will now call on the Deputy Political Leader of the United Workers' Party, former Parliamentary Representative for Castries Southeast, Guy Joseph, who will address you on the subject of healthcare. Or rather, he will also be focusing specifically on the St. Jude's Hospital that I was just speaking of.
Thank you very much, Mr. Montut. Pleasant good morning to everyone. Today I am here to address a few subject areas with specific focus on St. Jude. But I cannot help but comment on a couple of the issues raised by Mr. Montoute in relation, and I will limit my couple of comments specifically to Castries Southeast. He spoke about the Bexon Community Center. Can you believe that the center is still closed today because the Labour Party said they have too many toilets in the building? That is the only explanation we have been given about a facility that was financed by the World Bank, that the designs were approved by the World Bank, that the supervision was catered for by the World Bank. And that project, brand new completed building that can house over 1,000 persons at a time, is just sitting there for the past 3 years, abandoned by the Labour Party. And the only explanation they gave us is that there are too many toilets. While in Odsa, I assume that the message got out that there were too many toilets. So the toilets from the Odsa Community Center apparently was taken by people in the area. This is what happens with government property when you have a careless and reckless government making statements about things they do not understand. I also need to highlight the cul-de-sac road remains an eyesore. And if you pass along the cul-de-sac roads, you will see the fix-it signs that we have put on that road, because the commuters, the drivers, it's a nightmare. And while we know the road is under construction, all construction projects of existing roads that are still being used have a component of basic maintenance to make the road motorable. So it means that the Minister of Infrastructure is failing us once again in seeing to it that the basic needs of the people are met. Now I will go to my core subject area. But I want to preface my statement by saying, in the book by Dr. Chris Truman entitled The Lies We Believe, I will just read one line from this. It makes for very interesting reading. How have the lies you believe damaged your sense of self, your sense of others, your sense of life, your sense of God? And if you read this book, you will get the answer to the various questions. But the one I want to focus on the most is how the lies you believe have damaged your sense of life and your sense of others. Healthcare remains a major concern for all, and the inability of this government to adequately address the issues raised by the Saint Lucia Medical and Dental Associations remains a core concern for all St. Lucians. The contents of the letter are well known because it has been read on several programs and it circulates on social media. But I need to remind St. Lucians that this letter was written on the 31st of July, 2024. And I do have a copy right here with me. 31st July, 2024, where the Medical and Dental Association raised major concerns about what was happening at our premier health institution, the OKEU Hospital. I challenge the media and any Saint Lucian to go and find out, since the Medical and Dental Association wrote more than 6 months ago to the government, the Prime Minister, the Minister of Health. Has anything changed at OKEU Hospital? If there is any change, it is worse than what it was when the Medical and Dental Association wrote 6 months ago. Truth should mean something to us as an independent nation. And we are on the verge of celebrating another anniversary of Saint Lucia's independence. Truth should mean something to a small island developing state, a nation that has a say at the UN. We should stand by what is truth. And for fear that people misunderstand, truth is accuracy and correctness. And one other definition, it says, truth is the property of being in accord with the fact or reality. And I'm saying this to establish a couple points. Truth is the property of being in accord with fact and with reality. Unless and until we begin to hold elected officials accountable for their words, our Saint Lucia will not be the place that it ought to be. And that applies to every politician, whichever side of the political divide we stand on. Much has been said by both UWP and SLP about the St. Jude Hospital project. But I've said it before, and I will say it again. Time is a revealer of all things. The facts speak for themselves, and whether we choose to accept or reject a fact, that does not change the outcome, which is truth. So, if you choose to believe something, or you choose not to believe it, it does not change the fact that it is either a lie or the truth. So if you choose to believe a lie, it does not make a lie the truth. And if you choose not to believe the truth, it does not disqualify it from being the truth. Two statements made by the Prime Minister in 2013 budget speech. And I want St. Lucians to understand that we have to examine what has been said. Everybody want to tell you that's the past. Do not focus on the past. But sometimes we have to go to the past to inform ourselves for the future. So Dr. Kenny Anthony, in a budget speech, page 75 of his budget speech, garbage, and a dialysis building that there were clear indications that the floors were failing. The former government increased the allocation towards the construction of the hospital to $46.4 million. That is what Dr. Kenny Anthony said. And the former administration he is referring to was the Stevenson King-led UWP. The government has now been advised that this estimate is far below the real cost of the hospital, and additional resources will have to be identified to ensure its completion. Indeed, the cost of the hospital, including the purchase of equipment, is now estimated at $115 million. At the end of 2012-2013 financial year, the government had spent $47 million and had an outstanding amount of $68 million. For all practical purposes, the St. Jude Hospital will be a totally new building. Now, these are the words of Dr. Kenny Anthony. How could repairing an 80-year-old building make it a brand new building? I want the engineers, I want the brighter people than me to tell me how a Dr. Anthony could say, for all practical purposes, the St. Jude Hospital will be a totally new hospital. I wait for the explanations of his bright persons who usually defends him. So, the next statement is made in his 2014 budget, page 38. And it is important that I put this in sequence so that St. Lucians have a better appreciation of where we are as a people and how we got to where we are. Let me see. Yes. It says in his 2014 budget, page 38, Mr. Speaker, the scale of investment at St. Jude is no less impressive. When the project was originally conceptualized after the tragic fire of September 2009, only the surgical building was envisaged at an amount of $6 million. I want St. Lucians to note what was the cost of that project when it started. $6 million. The reality is that St. Jude, upon its completion, will be an investment of over $120 million. So in 2013, he said 115. Now it is over 120. This will create a 115-bed hospital, also with the latest equipment. And for those of you who may not remember, it was the same Dr. Kenny Anthony who said on a television interview prior to that, that for $60 million, we would have a state-of-the-art hospital. And I challenge him to say he did not say that, like he said he didn't ask the criminals to give the people a break for Christmas. So, these are the facts that we have to go by. The truth is the fiasco at St. Jude is the doing of Stevenson King, Kenny Anthony, and Philip J. Pierre. Many opening dates were given by then parliamentary rep for Babono, Miss Alvina Reynolds, and up to today, St. Jude still remains closed. UWP assumed office in 2016. And the last opening date given by the Labour Party was around August of 2016 for St. Jude. We did not stop the work immediately. SLP said in Parliament that paint and chemical is all that is needed to move into St. Jude. Mr. John Peters said only 5 to 20 million would complete St. Jude. People believed them. Was that the truth? Can you imagine if Honorable Alan Chasney had decided to take a chance against the sound advice of hospital experts and proceed with construction at a cost of $100 million in the old St. Jude? SLP, Mr. Peters, and many would call it bobble, because they had already determined that some paint and chemical and 5 to 20 million would complete it. How could the Honorable Alan Chasney-led administration come now and commit to spending $100 million to finish a hospital that SLP said 5 to 20 would finish? SLP would have rained fire down in Saint Lucia had we attempted to continue repairing the St. Jude for $100 million. But today, the same SLP, chemical and paint, and John Peters' $5 million is tight-lipped about the cost of St. Jude. But the facts speak for themselves. In the budget estimate for this financial year, $265 million allocated for St. Jude. And Reno is the contractor with foreign Indian workers, while St. Lucians are unable to find a job. Here is a stark difference. Under the Alan Chasney-led UWP, 99% of the workers at St. Jude were St. Lucians. Under the Philip J. Pierre-led SLP government, 99% of the workers at St. Jude are foreigners. And I need to repeat, the new hospital was being built by St. Lucians under the United Workers' Party. 99% of the people were St. Lucians. Today, 99% of the workers at the old St. Jude Hospital are foreigners. How did they get work permits in St. Lucia while St. Lucians remain unemployed? This is how the SLP puts you first. SLP is now spending over $400 million on an 80-year-old building damaged by fire. And you can add it. They had spent over 130 before. There are some contracts that was issued to Reno that we have never been given the price for, and there's 265 being spent now. You do the addition, and we are well over 400. All of us are the ones paying for this loan. This loan is not being paid from the pocket of the ministers in the cabinet. It is being paid by every taxpayer in this country. On the other hand, for less than 200 million EC dollars, the Honorable Alan Chasney-led UWP built a state-of-the-art hospital And when we say state of the art, we mean one that is climate resilient to resist a Category 5 hurricane, is also earthquake resistant up to a certain category of earthquake, was designed to keep out mold from the building. And we were having 2 hospitals for under $200 million, as opposed to an 80-year-old building that we are spending. The SLP government is spending $400 million. This new hospital, the new St. Jude Hospital, commissioned by the United Workers' Party government in 2016, would have an international component for advanced medical treatments that you presently have to go overseas to get today. It was also outfitted with a helipad so that patients could be flown into the hospital, get into an elevator, straight into the emergency room from the helicopter. There were also 10 private rooms in the new St. Jude Hospital, a separate dialysis and physiotherapy building. If you spend too much money on an old building, you will eventually make some use of it. But for how long? So do I expect that at some point in time, Labour Party will complete St. Jude? Yes, I do expect that. But at what cost? And for how long will the building be viable when the lifespan of concrete is between 80 to 100 years and the building is already 80 years? Regardless of who says it, the truth remains the truth and the lies remain lies. On page 30 of the most recent report, which was done by Mr. John Peters and his team, on page 30, they said that, or you can go on page 28, it says, the St. Jude Hospital Phase 1 can attain full approval from the Development Control Authority, and on the deed says the transfer of the entire operations of St. Jude at the George Odlum Stadium to commence within 18 months. And that meant that we should have moved into the old St. Jude Hospital by March of 2023. We are now entering February of 2025, and there's no indication that we are moving in. So, the report on St. Jude also says that the old building was more than 75% complete. Yet after a year of work, or a couple years of work by Reno and hundreds of millions of dollars, the most recent site visit at St. Jude said that the buildings were about 70% complete. Now, I want any right-thinking St. Lucian to explain this. I've told you, the only government that can reverse construction in the world is the Labour Party government. How could a building be 70% complete? 10 years ago, you have worked on it for 2 years. And you have spent $100 million, and it is still 70%. So the construction was in reverse. The construction was not going forward. And this is not a joke. This is not levity. This is the reality of what the Labour Party has reported. Who is lying? Is it the government or the contractor when they say that the project is only about 70% complete after 2 years. Saint Lucia, the facts speak for themselves. We told you that it would cost, based on the FDL report, it would cost over 100 million. You did not believe us. You chose to believe the Labour Party. We have to ask them to account for the $265 million of additional money that is being spent on this 80-year-old building. And it is the political season. But the facts do not change. And we are still convinced that the decision made by the United Workers' Party to build a state-of-the-art hospital that would have been in operation 6 months after Labour came into office, had they continued the work, we would have had a brand new hospital operating downstairs for St. Jude. We would have had an international hospital operating upstairs, which would subsidize the operations of the local hospital downstairs. And you would have a school, medical school, operating in the old St. Jude building. Healthcare would have been much better under the United Workers' Party. And the development plans that we had for Viewfort calls for a premier health institution which the old St. Jude cannot afford us. I thank you.
Thank you very much, Deputy Political Leader Guy Joseph. As you heard from Guy, an account of what has transpired and what is taking place as far as St. Jude is concerned. And I say to you, at the end of the day, with an additional over $200 million being expended, we will have a hospital that is not up to international standard, while the state-of-the-art hospital that I think St. Lucians truly deserve, that was started by the United Workers' Party, would have been abandoned by the present government. We are still on the subject of healthcare, and I would like at this juncture to call on the political leader, the leader of the opposition and member of parliament for Mico South, to further elaborate on the general state of health in this country. Honorable Alan Chasney.
Good morning, everyone. I think it's very important at this juncture that we actually take a step back to figure out how did we get where we are today. And I want to use this opportunity to create the framework that has motivated me, first of all and foremost, as a St. Lucian, and my decision to enter into the fray of politics. What has motivated me to do that? And as many of you would know, that I entered politics directly in 2006 when Sir John asked me to be part of his cabinet. Sadly for me, and I think for our nation, Sir John passed away in 2007. And I decided to stay in politics, and I'm glad I did. In that period, 2006 to 2011, I think that history will recall what I was able to achieve in tourism, and specifically having to deal with the world recession and also with Hurricane Thomas. And I'm hoping that persons would have had a greater appreciation of who Alan Chasney is. He's a person that remains focused every day on the plight of Saint Lucians. He's an individual that wants the best and is willing to rise to the challenge. So instead of cowering under the threat of the world recession, we found creative ways of rising above the fray. During Hurricane Tomas, in reopening the country and causing people never to lose faith, and soon afterwards having record numbers of arrivals, I think again speaks to who Alan Chasney is. And so when the opportunity was given to me by the United Workers' Party and my colleagues to take over the leadership of the party, it was something I was prepared to rise to. And I want to remind us again that when we came into government in 2016, what is it that we inherited? And what was the state of the country and what was the mindset of our citizens in 2016? Remember, unemployment was at 25%. Youth unemployment was at 44%. And the then Prime Minister, Kenny Anthony, had indicated to us in a very infamous interview that something had gone wrong as to why the government of Saint Lucia could not borrow any money. So in fact, the only amount of monies that the government of Saint Lucia could have borrowed by the time we got into government was treasury bills. And that was costly because the interest rates were a little bit lower, but every time that we had to roll over those treasury bills, the administrative costs were very high. And it certainly created a significant amount of uncertainty in government's ability to fund the government. There was no economic growth for 5 years. In fact, we had the largest deficits, and the amount of money that we were having to borrow was increasing every single year. And people were suffering. And I remember as a potential MP campaigning both in Soufrière and in Micoud South, and eventually throughout the length and breadth of this country, because I was going to be the political leader, the number of people that were not going to the hospital or to see a doctor because of the amount of money that they owed. And the pride that they had, and the embarrassment that they were going through. Even before then, but certainly even more, a greater emphasis was made to me about the state of Saint Lucian's health. And we've heard it over and over and over again that we have one of the highest rates of diabetes and hypertension in this country. And these are non-communicable diseases. The horror stories of persons, even if they made it to the doctor, did not have the money to pay for the prescriptions. And the number of families that were in significant debt because of unforeseen health problems and the cost. Because we're all the same. If a loved one is sick, in need of surgery, we will do everything and anything that we can at that time to help them. And people got third mortgages, people borrowed money from friends, people sold items, people did whatever they could do to try to raise the money and to deal with the financial problems afterwards. But those financial problems and the health problems created stress. It was heartbreaking to go to homes and see people who had been amputated because their diabetes was not treated early enough. Persons who had strokes because they had not been taking their blood pressure pills. And the impact it was having on households' income. Because not only was the income of the individual who had the amputation or who had the stroke was lost, but somebody from the household had to stay now behind and take care of that person. I say this because I want people to really appreciate the frame of mind of United Workers' Party in opposition. And if one goes now and reads our manifesto, and even if you read the vision and the mission of the United Workers' Party, it speaks right in the forefront that one of the core things that we have to do to improve the livelihoods of Saint Lucians is a quality, affordable healthcare system. And that is why when we came into government in 2016, we had a very clear plan. First of all, we had to grow the economy, which we did. We said we were going to reduce VAT to put some more money in people's hands. We did. We were going to drive investment. We did. And we were going to create an environment that would stimulate even more growth. Agriculture, IT sector, businesses. That was important because there was no one solution. There was nothing that say that you could put healthcare or economic growth separately. Because the fundamental problem with healthcare in Saint Lucia was inadequate resources. So remember, you have a government that's running a deficit, meaning they don't have enough money to meet their cost every year. To make matters worse, when we came into government, Guy Joseph spoke a lot about St. Jude's. I want us to go back in time a little bit because I have with me the St. Jude Hospital Reconstruction, the handover report. So this is a report that was done by Shante King when we came into government. And first of all, we must understand what the objective, the laid out objective of the government when we came in. And it says on page 3 and page 4. It says the short-term solution. And I read, this would entail the reconstruction of 2 of the surgical building on the old site, as well as the renovation of the other 2 buildings and other required ancillary buildings. The facilities would be made fully functional to allow St. Jude's Hospital to relocate from the stadium and operate until a new facility is built on this new site. So it means that Stephenson King and Kenny Anthony both accepted that the St. Jude Hospital, the old hospital, could never be the new hospital. But what they could do is to try to temporarily fix it immediately in order to move back in while they build a new hospital. It goes on and it says, and I quote, the medium-term solution. This would entail the planning, design, and construction of a new 90-bed care facility for St. Jude Hospital at a new site at Beau-Saint-Jude. In the vicinity of the George Olin Stadium and feature the future site of the National University. So not only were they talking about building a brand new hospital at Beau-Saint-Jude, they also were talking about building a university. Nothing new. Upon relocation of the St. Jude Hospital to this new facility, the old site buildings would be utilized for other medical-related purposes, such as a medical research or medical schools. So when they moved into the new 90-bed facility, the intention was to convert the old St. Jude either into medical facilities or into a university. The rationale for construction of the new facility is as follows. It would facilitate synergy with the National Vision Plan and act as a catalyst for redevelopment of the South in general. Its functions would be expanded for the use as a teaching facility. It would be used to facilitate healthcare tourism and serve St. Lucians, Caribbean nationals, as well as other foreign nationals with specialized healthcare facilities. This is a report, August 14th, 2016. So when my government came in and realized that phase one, which was to renovate the old building, had turned into a disaster. How do I know that? Page 19. I quote, during the period 2012 to 2015, the availability of funding dictated the pace of works on the ground. Despite the request by the project management unit for adequate financial resources to progress work on site, the funds made available were inadequate and work on the site was restricted to approved funds for the respective financial years due to budgetary constraints. As such, the strategy for implementation of works was dictated by funding. The PMU, the management group, advised the consultant Halcro on the available budget for the respective years. The consultant was charged with responsibility to identify a feasible scope of works out of the overall scope. This inadequate financing posed additional issues, especially with a change in the policy direction, which was eventually accepted by the new government in November of 2011. Due to the uncertainty of the funding, it was challenging to progress certain project components on the ground. So what did the report show us when we came in? That they had already spent $98 million. And there was a letter from Tracy Polios, who was at the Ministry of Economic Development, advising the then Prime Minister Kenny Anthony that they were going to need another $60 to $80 million to complete St. Jude's. So it means that you're talking about that they were going to eventually spend in excess of $160 million. And by the time that all of the accounts were reconciled by the Ministry of Finance, the $98 million that they had said that they had spent was actually closer to $125 million. Now, if one reviews the entire medium-term plan that we had, it begs the question, what should we do? Should we continue to try to fix the old hospital? Should we try to fix it? So what did we do? We hired a consultant that was recommended to us by CDB, FDL. We paid FDL $1 million EC, not some volunteer group of engineers that are hacks of the Labour Party or any of my party. Independent engineers. People from the University of West Indies and people from Italy, experts in their fields, to review what was going on. And the now infamous report said, at minimum, it would take another $100 million. But there was a caveat. And the caveat was the electricals and plumbing and the ceilings and the standard to get to become certified was questionable. And therefore, that when they went in and started breaking down some of the walls and examining the quality of those infrastructures, it could lead to an unlimited amount of money to spend to fix it. So we said, okay, on the basis of that, and the cost estimates of about $160 million to build a brand new hospital, a dedicated facility for healthcare in the South, that would be 220,000 square feet, which is 20% bigger than OKEU. Why? Because of exactly what they were recommending, that the facility should not be just a facility for locals, but understanding you have an airport, and with the intention of bringing a cruise ship port into the south, and also wanting to get it into medical tourism and providing facilities for the other Caribbean islands, we went ahead with that project. And in keeping with the same plan to convert the old building into a nursing college. Exactly the same thing. But in their typical haste of nasty politics, of lies, supported by hacks, would have come and tried to convince the people of Saint Lucia, including the member from Labrie. All we needed, we fooled the people of Saint Lucia. We should have continued to work on the old hospital, because all that was required was chemical and paint. And within 3 months that they could have been in. Well, we now all know that that is a lie. Because when the government came in, instead of continuing the works of the new hospital, decided to go back in time to go into a hospital that they themselves knew. Let me read it for you. On September 9th, 2009, the St. Jude Hospital located in Auger, Vieux-Fort, was devastated by a fire in St. Jude Hospital at the cantonment. A 97-bed major referral hospital on the island was rendered non-functional. The fire destroyed the surgical ward and operating theaters of an already aging plant that had been built since the 1940s. So they knew. But they told you, chemical and paint and $30 million, and within 3 to 6 months, we should have been in. The government now has been in office for 4 years. 4 years. And their budget says they intend to spend $265 million in addition to the $150 million that they've already spent. Did we listen to that? They're spending $265 million on a building that they all said all it needed was chemical and paint to move in. And if they had continued, as Mr. Joseph said, on the new building, 3 years ago, we would have been in the new building, and we would have saved $150 million. The same thing existed at OKEU when we came into office in 2016. The OKEU hospital had been finished, had been completed. The dialysis building was already functional. And the government could not open the hospital. In fact, because so much pressure was being put on them, what did they do instead? They did a naming opening. They went and named it OKEU, and immediately afterwards closed it and took fancy pictures to fool the people. So again, when we came into government, you had St. Jude's Hospital that was a disaster. OKEU, no plan and no money to open it. And they were not even following their own plan that was put together in 2000. Which said in order for these two hospitals to work, we had to strengthen our healthcare facilities, because people are supposed to be diagnosed at a healthcare facility, treated at the hospital, and then go back to the healthcare facility for recovery, because you don't want people to stay that long in the hospital. That's why there was a reduction in the number of beds. And remember, the government could not borrow money. Something had gone wrong. I'm saying this I want us to understand the environment that we came in and the sense of urgency that we had to put in place. We quickly realized that to provide affordable, quality health care for St. Lucians, the idea of universal health care could not work. And that we had to quickly get the St. Jude's Hospital problem resolved. We had to operationalize OKEU. We had to invest in our healthcare facilities. But very importantly, and a critical component, was to introduce healthcare insurance. Now I laugh when I hear the government today say, oh, they found nothing on healthcare insurance. I challenge the media to just go back and do some simple researches and see the number of press conferences, the number of government officials that were speaking about the $5.5 million US project with the World Bank, specifically to help introduce healthcare services, improve the healthcare services, which included a healthcare insurance program. The number of meetings that we had in cabinet with the experts, whether it should be through NIC, whether it should be a standalone, how much are we going to charge? And as we were about to phase it in, because remember, OKU was not open. So until we could establish a revenue stream to pay for the services at OKU, I laugh at when I hear the Prime Minister today talk about, oh, OKU is costing $100 million. Well, we said that to you repeatedly. That the University of West Indies did an estimate that it was going to cost $75 million. You don't understand? Or you don't want to understand? And now today, you're realizing that it's $100 million? You played politics with Millennium Heights, with the idea of the staff now being hired by Millennium Heights, transferred to Millennium Heights as an organization. You said to the people of Saint Lucia, we were going to privatize healthcare in Saint Lucia. Rubbish, nonsense, lie. And those same lies now are going to come back and haunt this government. Because all the basic things that they should have been doing, they have now backed themselves into a corner. Just like the St. Jude's. And so out of embarrassment and out of politics, that they would take up and adopt a policy that's contrary to the benefit of the people of this country. And it's heartbreaking. Because every day people are suffering. Every day people want to know that there's a sense of urgency to solve the healthcare problems in this country. And all they are given is propaganda and lies. Victoria Hospital had no operating systems. I've spent at length when I went through Victoria, the accounting system, the old computer systems, the lack of processes, and compared the difference between the operating system of the hospital, the management system at Victoria, compared to St. Jude's, because St. Jude's had the benefit of Mercy Hospital. So here's the next big lie that has cost lives in this country, has cost millions and millions of dollars of inefficiencies, is what we were doing with Cayman Health City. Cayman Health City was not coming in here to operate OKEU. If they were going to operate anything at OKEU, it was going to be the fifth finger as a private hospital. But the opportunity came now to do an expanded hospital in the south. And in discussions with Tapia, we agreed to leave the space to Tapia up north and put an international hospital in the south. But they were also now using a proven management system to operate OKEU and St. Jude's. And so the training was in that regard, and also when COVID came and we couldn't get anyone to help us to transfer immediately into OKEU, it was them that came down. So when the government tells you about $2 million a month and we're wasting money on saving people's lives, that's a waste of money. To put in operating systems that would have prevented from the nonsense that's taking place now at OKEU. And you bring a politician now to come and run the hospital, and you want to tell the people of this country that you care? So the role of the healthcare insurance is that the government would make it that every single St. Lucian would have to have insurance. And that insurance coverage was going to be about $1,000 EC a year. For those persons who were employed earning a salary over a certain amount, you would have shared that expense with your company you worked for. So the maximum would be $500 a year to give you $75,000 worth of coverage. Government agreed. All the persons on the poverty list, all the single mothers who were unemployed, all the people who became unemployed, government would pay that amount for them. So that every single St. Lucian would have insurance coverage. Everybody can go to the hospital or to the doctor and know that their basic needs were going to be covered, and to regain faith back into our health system. No, you come into office, you lie that there was no reports and there was nothing there for healthcare insurance. All the studies were there. But you lied. And then you went and told the people you're going to introduce universal healthcare. And then when you start realizing you couldn't do it, you went and lied again and said you're going to start with the elderly, people over 80. And maternity. And how many stories have we heard in the last months of people who are over 80 who are going to the hospital, and all of a sudden, oh, no. It does not apply to the main hospitals. It only applies to the healthcare centers. And yet the healthcare centers do not have the equipment or the staff to treat these people. And we said it. We were starting to fix up the healthcare facilities. Where does this government go? The opposite direction. You know that you're closing down the Castries Health Center. You know that Marcia is closed. Do you even bother to upgrade Entrepot? No. Do you upgrade Leclerc? No. Do you upgrade the polyclinic at Grosley? No. You want to come now and tell the people of Saint Lucia, oh, we're going to fix up the polyclinic at Grosley so it can operate 24/7? Today you're coming to say that? Has anybody gone there to see what service people are getting? This is what motivates me and United Workers' Party every day, is the pain that we see people are going through, the indignity of which how they're being treated. And Skiddy is only one example of that indignity, and his refusal to die in an emergency ward. This government has failed the people of Saint Lucia in so many respects. But the greatest amount of damage that they're doing to this country is what they have done to our healthcare services. They said that they're going to follow the science. That's a lie. That's just a term. I want to say United Workers' Party remains committed to the development of St. Lucia. And healthcare remains an absolute priority for us. And as soon as we are reelected into government, we will immediately recommence the plans that we had of introducing a healthcare insurance for every single St. Lucia, continue the work that we did where we had 16 healthcare facilities that we had improved upon, continue that work, put in proper management systems that St. Lucians would be proud of, and to give them the training so that all of the nurses and doctors can be St. Lucian. Today, the letter that Guy Joseph read, what's the result of it, of what the Medical and Dental Association said? The doctors and nurses left. They're gone. The government has not even given us a report. How many new doctors have they brought in? How many new nurses have they brought in? Where are they from? My understanding is that Cuba has been very generous. But the question is, how much has that been costing us? And how can you take Spanish doctors and Spanish nurses and put them in an already broken management system and expect it's going to work? Cannot work. And we're seeing the results of it, and the people of Saint Lucia are suffering through this irresponsible administration. All the evidence is there that this government has lied and have no interest in the health of the people of Saint Lucia. And they themselves have not understood that if we don't have a healthy nation, we could never achieve the potential that we have. We need all hands on deck. And with what is taking place globally today, of nationalism and people putting themselves first in their own countries, we have to become dependent on ourselves, and we have to raise our standards, and we have to be willing to grow and to be as successful as those countries. If we don't, we're going to be isolated. This government has even spoken to the people of Saint Lucia about the urgency that we have, and to be honest with themselves as to what's taking place in healthcare in this country. But United Workers' Party has a plan. United Workers' Party will fix the problems that we have today. And United Workers' Party recognizes the importance of health to every single Saint Lucian. And in particular, the elderly. We must take care of the elders who have taken care of us for all these years. It's a priority. And I want to reassure again all Saint Lucians. United Workers' Party takes this very seriously. We've shown that we can do it in the past, and we will do it again. Thank you.
Yes, ladies and gentlemen, we just heard from the political leader of the United Workers' Party, leader of the opposition, and member of parliament for Mico South. And there you had it, expose, so to speak, on the health situation in Saint Lucia. A dismal picture. Real and truly Saint Lucians, we are in dire straits. Something must be done. I want to assure you, I want to encourage you, and let you know that we should not give up hope, because there is some light at the end of the tunnel. An alternative exists, and that I can assure you will come from the United Workers' Party. All Saint Lucians must take a responsibility for themselves and for their health situation, and of course, when the time comes, do the right thing for your own benefit, for your health, for your life, for your future. I want to thank those of you who have been following us here and in the diaspora on live stream. But before we end, I want to invite the members of the media, if they have questions for our presenters, to please proceed in asking your question. Please identify yourself and indicate to whom you're directing your question.
Question to all of you, I guess, as the members of the United Workers' Party. I don't know if you have heard the statement from the member of parliament for Bruce Lee. As I said, your party has much personal capital of him and his family, and it's referred to several social media posts that have been, things that have been posted by Unitedpac, concerning, I guess, some language purchase I think last year, also his relationship with past relationship. As I said, he's criticizing the way y'all go about, I guess, politics, and he's claiming the SLP, I guess, holds the highest standard. So I wanted to get your thoughts.
Okay, well, I do not know if any of my colleagues would wish to comment, but I certainly would like to comment on this. Now, first and foremost, let me just say that I despise the hypocrisy that I see coming from some people in the politics. And Kenson Kazimi in particular, you would recall in the last general election, on his platform, okay, Azi and Shazi stood on his platform in his presence and called me a kidnapper. He endorsed the statement by making reference to me in the same light, in the same vein. Okay? He is now complaining about statements that were made about him. Well, let me just say this. Kenson Kazimi, you are a public figure. And if the public asks questions, expressing concerns about some of their suspicions, it is your responsibility as a public figure to come out and clarify. There is an integrity commission. I'm hoping that when the public raises concerns about the assets and wealth of individuals that raises suspicion, that some investigation is carried out. I would like to also indicate to the prosecutor, the public prosecutor, that that is a matter worth investigating. I say to Kenson Kazimi, if I were you, rather than cry foul, I would come out and indicate to the public, as they have a right to know since you're a public figure, exactly what is the source of my wealth and how I came about owning and having some of what I have. I am no longer in active politics. Having been in active politics, if anyone wishes to question anything that I have, anything that I own, I will make it public. I will disclose to the public, as they have a right to know, exactly how and where I got what I have from. I suggest to Kenson Kazimi that he do the same. Because if there seems to be some mystery to the people, they have a right to ask for clarification, him being a public figure.
It is quite interesting when public figures are attacked that they level it at a party. So if people are asking questions about Kenson Kazimi, then he should answer the questions rather than try and deflect that UWP is trying to do so. Who more things have been asked of in the politics than myself? More accusations leveled at my family, what I own, how I owned it. I always declared to Public Integrity Commission. I always did what I had to do. In fact, most recently, the Prime Minister announced about 2 years ago that he had recommenced the Linquist report. So it is not just Kenson that is under scrutiny by the people of Saint Lucia. I think the whole Labour Party is being scrutinized for what is going on. Because, let's be blunt about this. Fresh Start got a few jobs, and I was accused of being some shareholder of Fresh Start belonged to me. Have they not been able to establish today who Fresh Start belongs to? Richard Frederick is working with Fresh Start, said he just started eating his vomit. So you really believe Richard Frederick is working with Guy Joseph? You see, these are the real questions that St. Lucians need to ask themselves. And yes, Mr. Kazimi, the lands that you purchase, there should be a declaration. If you took a loan from the bank, the record should be there. If you had your cash savings and you use it, it should be there. But we have a right to question what you have and how you got it. Because presently, the government has made some deals. The cabinet. There's no way I believe that GPH was given for $40 million. There's no way I believe that the lands at Banans was just sold for $1 million US when it was valued in excess. In fact, Reno himself said if they're giving him $25 million now, he is taking it. So you think the land value appreciated between Reno buying it for 1 million US, 2.7 million EC to 25 million now? No. So I believe something went on there. The $1 billion that Galaxy has collected. And to me, I see some of the apartments being spoken about looking like some Chinese buildings. Isn't that cause for concern? Is there a connection between what happened at Galaxy and what some of the villas we are seeing going up on private properties? So shouldn't the people of Saint Lucia, whether it be Unitedpac, whether it be a regular resident of Grozile, or whether it be a politician on the United Workers' Party side, we have a right to question what is happening. Because it cannot be that people who couldn't pay child support a few years ago have now become millionaires in this country and owning assets that people have to question where it came from. I've always told them, when you want to screen Guy Joseph, I can give you my track record. They knew how many buses I had before I came into politics. They knew how many trucks I had. They knew how much heavy equipment I had. But they pretend as if it's when I came into politics, I got something. I worked hard all my life. And I continue to work hard as I speak there. But these fly-by-night politicians who have become millionaires overnight, they have to account. And the people of Grozile, Mr. Kenson, if they are calling you to account, not some people say private business, bedroom business. We have not gone into your bedroom. We have not discussed your bedroom business. But you all choose to discuss people. You all say the Labour Party said the most outrageous things about my wife. Imagine my brother died and Labour Party operatives posted on social media. They posted the wrong brother as having died. That is how heartless these Labour Party operatives are. And you know what? Because they said that's the brother who was holding, and I was crying unconsolably. And you know what? At his business place, when the secretary answered the phone, she had to say, no, it's not true. Because the calls were coming in by the seconds. That is how wicked and heartless Labour parties. They don't care about family. They don't care about who you are. My sister signed as an employee of a company, as a witness to a contract. Philip J. Pierre, who is Prime Minister, made an issue out of it in Parliament. Kenny Anthony and all of them. You think they don't know the difference between a party to a contract and a witness to a contract? They know, but they choose to attack people. And when people question them on legitimate things that is questionable, they call it political attack. This is no political attack. All of us have to declare. And y'all can go and check my record at Integrity Commission. And you know what? If you made a false declaration at Integrity Commission, you could be fined $50,000. And I went through my integrity report form. Strangely, last night I was going through some past records that I have, and I came across, and it is interesting to see the Ernest Healers who never filed. On both lines is no. And I can show you. They want to challenge me on this. I have a copy of the report. Because the Integrity Commission would give you, and I'm not talking about as he is in government, you know, I'm talking about when he was High Commissioner in the UK. So these are legitimate questions. And the old people say, if you don't have cocoa outside, you don't look for it. So I never look for rain because I have no cocoa outside. So Kenson, if you have cocoa outside, look for the rain. It's coming.
I think that what's a more important question to be asked is, how are these questions coming up and why? And they're coming up because of what happened with the NLA and the $80 million loan. So remember, NLA went to borrow $80 million and went to the government of Saint Lucia to provide a guarantee. So what does that mean? If anything happens to our lottery and the lottery is not raising enough money, the entity that has to make up the difference is the taxpayers of the country. We wrote a letter and we said there was something fundamentally wrong because on the same day of signing that, we strengthened our procurement guidelines for government. And I thought at minimum, because of the guarantee, that there would have been a requirement for the NLA, who was not designed to implement projects, to build anything, only to provide oversight of our lottery, that there would have been some condition that they would have had to adopt the procurement guidelines of government, or a separate independent entity would have been put in place to oversee the disbursements of the contracts. So instead, what do we have? $80 million. No one in Saint Lucia, except the NLA and maybe the minister, know how much money has been spent. It's impossible for me or for anyone to believe that we spent $80 million on the Darren Sammy Stadium. We see the work that was taking place at the Grosley Field. It's not even a year and the wall has broken down. NLA has provided no report as to how much money they've spent, who got the contracts, nothing. Instead, you have a situation, and if I read the Unitedpac's story, you have a situation where a lawyer who is professed to be the lawyer for the NLA and one of the supposed contractors of the $80 million both facilitated the minister in a housing development in Grosley. And the documents are there, public documents, not falsified, that show the land cost $270,000 and that he borrowed $160,000 and he put down $100,000 in cash. But that's just to buy the land. Where did the money come to build the properties? And remember, this is the same minister that very early on was building and adding on to a villa, of which he said, well, that's from his salary. So if Mr. Casimir believes that pressure is being put on him, it is the lack of transparency. But here's the most egregious thing that he has done. That he's the Minister of Youth. He goes around purporting himself that he is the great savior of the youth of this country. Yet it's under his administration that now the NLA is having to pay back $800,000 a month for 15 years. And my understanding is that the persons who are running the lottery for the government of Saint Lucia are now being required to send the money directly to the bank. So it's not by coincidence that the youth games didn't happen, school games. How many other athletes, how many other students are now being deprived of resources? And where are those resources going? And I want us to again remember, just yesterday, a very good friend of mine, what's his name? The guy with the patch on his eye? D. What's his first name? Marcus D. Would have the audacity to put out a list of things to say, oh, until the United Workers' Party answers all these questions. And one of the things he put out was the $33 million for Don Lockerbie. So, Marcus, this is for you. Soufrere playing field with a track and lights. Denry, football field, lights, training facilities. Miku football court, Deriso football court, and the Grosile Sports Academy. That's where the $33 million is, because Lockerbie himself and his firm only got $2 million. And the irony is that the government came out publicly and said that they're going to give $4 million for a person to redesign the George Odlum Stadium. Twice as much as Don Lockerbie has played. But I want to ask him, where's the $80 million? Where is it? And so it is the lack of transparency, the lack of any accountability, the lack of process, and it's the persons that you choose to idolize in your life that will get you in trouble. But it's the young people of this country who are being made to pay. $800,000 a month is being taken away from the NLA, and to support the young people of this country. Shameful, disgusting. And it's only a matter of time that all the sports clubs and the young people of this country realize that Bebe is a failure and that he's there for himself. I have no difficulties in saying that. And the hypocrisy of the Labour Party to want to come and talk about name calling. I have a list. We all have a list. That's the badge of honor that we wear. And the damage that they've done to everybody's reputations, including Saint Lucia's own reputation. So, as has been recommended by my colleagues, if he wants, provide the information to show the information is wrong.
What are your thoughts on the code of ethics for politicians? Because we've seen over the years the increase in the level of discourse has gone down between both sides. So what are your thoughts as a position leader and leader of the code of ethics for politicians?
A code of ethics requires character. You know, so when you have a Richard Fedrick in your midst, and you want to put him in the Prime Minister's office, where are you going? But I think it's also very important to understand how far away we are from that. You have a government that has the majority in the House, in fact, 15 seats. So it means making any amendment on the Constitution, easy peasy. What are the things they've chosen to do? To try to bring a deputy speaker in. Remember, they're the ones who said that we were required to have a deputy speaker in the House. They came in to make the amendment to allow a new deputy speaker to come in outside the House. Is that consistent with what they said? Remember, that's the constitutional change they've made. There's an argument still going on of moving to the CCJ. Should we have had a referendum? And even if they believed that they could do it without a referendum, should they have had enough trust in the people of Saint Lucia to allow a referendum to take place? What other changes have they made constitutionally? This is a prime minister that on the first night of the election, driving back up from St. Jude's Hospital that night, I called him to congratulate him. I have never spoken to the prime minister since then. Same prime minister that would oversee and allow for my security to be moved. I haven't tackled him yet. I want all of us to think for a moment that a commissioner of police would act on his own to move the security of a leader of the opposition. You don't think, even as a matter of course, that you picked up the phone and called the prime minister and say, PM, before I do this, blah, blah, blah. That's how far away we've gone in reverse when it comes to etiquette. So I want to say, I don't like when people say that all the political parties are the same. We in the United Workers' Party are trying to be different. And the fact that you're still convinced, and many people are still convinced there's no difference, tells me I have a lot more work to do. But I certainly want to hold all the members of my party to a higher standard. We have no relationship with Unitedpac other than they share our name. It's my understanding over the years the persons that have been involved in Unitedpac change. And from what I understand, they are members who support the United Workers' Party. But I have to say to you, I can show you many examples of where Unitedpac has attacked me or policies that my party has. So, in fact, it's a group of people, from what I understand, that support the ideology of United Workers' Party and what we stand for, and sometimes have a very different opinion as to how that should be managed. But they are an independent group. As I said to you, from time to time, from my understanding, the people who are running it change. I certainly publicly know how to reach out and say something, but I have, and the party has, zero control over Unitedpac.
If I could get your thoughts on the fixed indirect tax for cruise ships coming in, the effect this in January, if you could speak to that on the impact for on GPH, for instance.
So let us again understand what's happened with GPH. Negotiations took place with GPH, and the proposal was never put out to bid. So in essence, they negotiated directly with GPH and gave GPH the concession without any formal bid. It is my clear understanding, and I have evidence to substantiate that the Ministry of Finance, technical staff, advised the government not to do the deal with GPH. And that is when it was at $6.50. That's how much we were collecting before, $6.50. $1.50 was going to solid waste, $2.50 was going to SLASPA, and $2.50 was going to the government of Saint Lucia. In fact, the Ministry of Finance said it would be better for the government of Saint Lucia to forego its $2.50 and allow SLASPA to get $5, because with the $5, they could more than cover the cost of the loan, of the $18 million loan, and they would have had enough money over the years to do the development themselves. And let's understand, it is SLASPA who built Point Seraphin. It is the government of Saint Lucia who built the Vendors Arcade. It is SLASPA who built Place Carnage. So there was nothing that's in this proposal that the government of Saint Lucia, either through SLASPA or a different entity, has not done themselves. Not a part of capacity. So the recent announcement that the head tax in January went from $6.50 to $12.50, where $10 now is going to go to GPH, $1 is going to the government of Saint Lucia, and $1.50 is going to go to solid waste, is horrifying and reveals the scam and the level of the corruption that has taken place. Why on earth, if the government of Saint Lucia was prepared to go to $12.50, so imagine in that $12.50, the $1.50 for solid waste, government of Saint Lucia could have still gotten its $2.50, and SLASPA would have gotten $9. So you're talking about, in 40 years' time, over $400 million US. And to Minister Joseph's point, they could have done everything, including they could have built the cruise ship terminal in Vieux Fort. What was the necessity? Why would you have given away all of this money? And to make it even more suspicious to all of us is that GPH started off as being a public company. And 6 months ago it was announced that they had become now a private company. So whereas we were getting information on GPH, now we're getting none. And that there is information out to say that the main shareholders of GPH have sold 60% of the shares, 66% of the shares. So we don't even know who the owner is. And again, like CIP, the money is coming in and going straight out to a third party, a foreign company, who turned around now and did what? Hired friends of the minister, hired friends of the vice president of the bank, hired persons who are in the Senate as public relation officers and consultancy work. So it means that we have no idea, or we're not even allowed to ask how GPH is spending the $10 million US a year. This is scandalous. So when you add up CIP to to Galaxy, $1.8 billion US dollars. Another $100 million to BMAX, $1.9 billion. $30 million for NLA, and $400 and something million to GPH. $2.65 billion US dollars, over $6 billion of monies that belong to the people of Saint Lucia, whether it's through CIP sales, whether it be through the head tax at the port, or whether it be through our lottery, has been given away to other people, and there's no accountability for it. We should all be enraged. We should all be marching the streets because we cannot trust this government. And you know what the sad part is? That the 2.5% tax that's causing a burden on the people of Saint Lucia will remain. The Prime Minister said so. And it's my understanding that the government intends to increase the tax on the hotel sector. Hotel sector that is dying. If you go and see the flights coming in, empty. But no, there's a big rosy picture. You're going to have a jazz festival that came out late. How's a jazz festival coming out now going to help? It's for one weekend. But that's the level of mismanagement and corruption that's taking place in this country. I have no qualms in calling it that, because there's no other explanation for why 2.6 billion US dollars would be siphoned from the resources of this country to third-party people with no level of accountability.
Any other questions? So, not to belabor the point, in closing, let me just direct this to the parliamentary representative for Grosley Lake, Kenson Kazimi. Sir, stop being a chicken and stop crying foul. At the end of the day, you were asked questions about your assets. As a public figure, declare your assets. When you, Kenson, questioned the fact that I was driving a second-hand Lexus after government ministers were granted duty-free concessions on vehicles, I responded by telling you, go to the Teachers Credit Union. I used to be a teacher, I'm still a member of the credit union. Go to the Teachers Credit Union, and I can give you a letter to ask them for permission to disclose and divulge to you what my information is. When you all questioned my farm, I indicated to you all that you'll go to the Saint Lucia Development Bank. Even if at the time my records were not totally up to date, I was prepared to make it public and let you all know where the funds came from. My advice to you, sir, do the same. Let the people know how you're doing so well and Grosley is doing so badly. Explain to them where the money has come from. Simple as that. I want to thank you, members of the media. I want to thank all our listeners overseas, in the diaspora following us, and those of you in Saint Lucia. Thank you, and please join us next week for another United Workers' Party press briefing. Thank you very much.